Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me today at GYN Corner. Today is a special presentation. I had a viewer request to speak on how this whole coronavirus, COVID-19, how it affects pregnant women. I originally was not going to speak on coronavirus at all, simply because so many health providers are speaking about it that I don't think I need to add anything to the mix. But I do try to always answer viewer questions. So a viewer asked the question, actually I just saw it a couple days ago, but the question was asked about 2 weeks ago: how does the coronavirus or this COVID-19 disease affect pregnant women? So I guess my first statement will be to always, if you have medical questions, you could always go to the Centers for Disease Control, CDC. They have a website. They have all of the issues with the majority of community-acquired or epidemic, pandemic, infectious diseases, and management and treatment. So you can always go to the CDC website. They have information on corona and pregnancy. When it comes to women's health issues and pregnancy, you can also always go to the American College of Obstetrician Gynecologists, or the ACOG. We have a website through our national credentialing body, and they have a patient portion, so you can always go to the patient segment of the American College of Obstetrician Gynecologists, and they will answer questions for patient information. And then I guess lastly, I will answer the question myself. So the big answer is we don't know. So if you go to CDC, a lot of the information says we don't know. That's because, as we know, they're calling it the novel coronavirus. That's because it's a new infection. So we don't have enough information and experience and statistics built up to really give solid answers for most of the questions that people are asking. So the big answer is we don't know. And because we don't know specifically how the coronavirus affects pregnant women, we have to extrapolate based on what we know about pregnancy, its state, and how other viral infectious diseases affect the pregnant state. Now, I'll just backtrack for 2 seconds and say that I get a lot of questions from patients on what's a virus, what's a bacteria. My pat answer is you have to take a course to know exactly what the difference is. The shorter answer, I guess that's a short answer. The long answer is, bugs, bacteria are bugs, and we treat them with antibiotics. So they're kind of like germs or cooties. So bugs are bacteria, or another word people use are microbes. We treat bacteria with antibiotics. Viruses are they're less substantial. They're mostly in the air, and we cannot treat viruses with antibiotics except for a very, very small portion of viruses which, for whatever reasons, actually can act like bacteria.